All right, so welcome back. This is our second to last session of the day. So I'd like to welcome Yifan Zhang. She's one of the newer users on our compute clusters at the HPC Center. And she's actually bringing a very interesting use case that we haven't seen before. Some very interesting analytics that they're doing. And it's brought some interesting challenges for us in the way that we provide services to users. And so she's has, I believe, a joint appointment in the medical school and relationship with the law school. But she's here to present on work that they've been doing over the past few months on our systems.
Thank you, Steve. And thank you for everyone staying until late into the sessions. So my name is Yifan Zhang, and I'm a research fellow at the Center for Health Policy here at Stanford. Today, I'd like to share with you a project that we're currently doing at the center. So I'm afraid I have to say, maybe in the presentation, there are not many amazing computer science development or advanced programming skills as the other speakers have been sharing with us yesterday and today. But I hope you find the topic of the project interesting and maybe view it as an example how HPC can be a valuable resource in social science studies and even to someone without advanced programming skills like myself. So I hope you enjoy the presentation, and I'll be looking forward to your comments. So the project we're doing is a cohort study of the health effects of firearm ownership in California. And so this is our research team. Dr. Studer is a principal investigator. He is a professor at Stanford Law School and Stanford Medical School. Dr. Miller is an epidemiologist. He is a professor at the University of Northeastern and co-director of the Harvard Injury Control Research Center. Dr. Rodden is an expert in spatial social science, and he is a professor at Department of Political Science here at Stanford. Dr. Swanson is an epidemiologist, and she is an assistant professor at Erasmus in Netherlands. Dr. Wintermout is among the first to study firearm violence as a public health problem, and he is a professor at UC Davis. So in the presentation, I'll first describe our study, and then how we're using HPC to construct the study cohort. And I'll share with you a few lessons I learned from working on this project. So the research question we're trying to answer is, what health risks and benefits does firearm ownership entail? By answering this question, we're hoping to allow a more accurate accounting of risks and benefits to guide laws and policies aimed at addressing firearm safety. And by subpopulation analysis, we would like to identify characteristics of individuals at highest risk of experiencing firearm-related mortality so that we can prioritize and target gun violence prevention activities. So the existing evidence is actually quite strong. There are at least a dozen of previous studies looking at this question, and most of them are using one of two study designs, ecological studies or the case control studies. So the ecological studies link estimates of firearm ownership in regions, like states, cities, to public health outcomes in those areas. And a number of ecological studies detected positive association between levels of firearm ownership and rates of firearm-related suicide and homicide. Also, a limitation of ecological study is that the relationship these studies identify is not causal, and it's hard to make causal inference using ecological studies. And another type of study is case control studies. And case control studies currently provide the best available evidence on risks of firearm ownership. In a case control study, the researchers first So they begin with a group of people who have experienced the outcome of interest, for example, the firearm-related suicide. And then they determine how many of them own the firearm, typically by interviewing their relatives. And then they make the same determination with a group of controls. Oftentimes, like asking them directly, do you own a firearm? And then match the controls with the cases. So the most rigorous case control study identified that firearm owners have 2 to 5 times the odds of dying by firearm-related suicide and 2 times the odds of dying by firearm-related homicide. But this type of study also have like methodological limitations. The first one is recall bias. So if the relative of someone who recently died from a gunshot, when people ask them if the deceased owned a firearm, they're more likely to answer yes. So that's the recall bias. And the second type of limitation is that it's hard to estimate how the risks are changing over time in case control studies. And finally, in case control studies, we're limited to reporting relative odds instead of absolute risks. So these are the limitations of the case control studies. There is actually a third type of study design that have been used to answer this research question. So that's a cohort study. So the cohort study provides more robust causal evidence than ecological or case control studies. However, there's only one cohort study of firearm ownership risks. And it was done by Dr. Wintermote in 1999. Why is that? Because in cohort studies, so for the firearm-related homicide and suicide, it's a rare event at population level. However, the cohort study often makes the requirement, like knowing firearm ownership status for a large sample of populations. And that information is elusive in the US. So that is a facility challenge for cohort studies. For example, in the Wintermote study, they followed 240,000 purchases over a period of 6 years. And during the study period, there were 188 firearm-related suicide and 40 firearm-related homicide. So that number of events really limited the study power to detect certain effects and preclude a more detailed analysis of subpopulation studies. Also, because the follow-up time is only 6 years, it's hard to get an estimate of the cumulative risks from the study. And the third, because the study happened 20 years ago, so the consequence and dynamics of firearm ownership may have changed during this period of time. So when we're designing our study, so after reviewing these previous studies, we decided to employ a cohort study design. And we're working to expand the cohort. So compared to Wintermote study, it's about 15 times larger. So it will provide ample statistical power for our research question. And the cohort members will be followed up for up to 14 years. And this will provide estimates of the cumulative risks over time. And so that follow-up time goes from 2002 to 2016. From that, we can get up-to-date estimates of ownership risks. So how we're going to construct the study cohort. So first, we'll obtain purchase level information from the Department of Justice, and then combine that information with the general information on California residents. And then we'll search for the occurrence of firearm-related deaths among cohort members by cross-referencing mortality data from the California Department of Public Health. In specific, so we obtain data from 3 data sources. The first one is the dealer record of sales database, so the DROS database. DROS is actually a form that you fill out when you go buy a gun. And the database was obtained from the California Department of Justice. So in California, whenever you want to buy a gun, by law, it has to be done through a licensed dealer with background check. So if you want to buy a gun, you go to a dealer, fill in the DROS form, and the form is submitted to the DOJ. And if you pass the background check after the waiting period, you go back to the dealer and pick up the gun. So this applies even to private party transfer. So if a brother wants to transfer his handgun to his sister, by law, they also have to go to a licensed dealer, complete the same process, and finish the transfer. So what information does the DROS form provide? This is the DROS form, and it has sections about the transaction, for example, when the transaction takes place. It has information about the weapon, what type of gun it is, and it also has sections for purchases. So for purchases, typically people just swipe their California driver's license, and all these informations are automatically updated in the system. And then if it is a private party transfer, there's a section for that. And the dealer also have to enter their information. So we get 4.8 million transaction level records on handgun purchases from DOJ. That goes to from 1995 to 2016. Each of record has details of transaction, weapon, and the purchaser. So after we got this information, we combined these information with the California voter registration files. We obtained 17 extracts of California voter files from 2002 to 2016. Each of the files contains about 15 million registrants. And the variables it includes are names, sex, address, and date of birth. However, and unfortunately, it does not include race information, and that's something that we need to work on. And after combining the data sources, the data from the first 2 data sources, we are now in the process of obtaining the California Death Statistical Master Files from the Department of Public Health. We're hoping to get an extract covering all recorded deaths between January the 1st, 2002, and the date of extraction. So the project officially kicked off January 2017, so that's last month. But we have been doing some work obtaining data and doing the cohort construction. So it's during this process that we started exploring the possibility of using HPC to construct the study cohort. So recall that for the study cohort, we need to combine 2 different sources of data. And we're particularly interested in looking at the effects of a few predictors. For example, age, gender, residential location, and race. So in the DROS file, because everything was pretty automatic when people swipe their driver's license, first of all, we have the information on these 4 predictors. And the quality is pretty good, less than 1% missing for each of the predictors. And when we look at the voter registration file, it includes information on age, gender, residential location, but not on race. And when we check the quality of the data, less than 1% missing for age and residential location, but for the gender variable, depending on which year it is, the missing data can range from 1/3 to 2/3. So we need to impute the missing values of gender for those years, and we also need to impute people's racial groups. And these 2 imputation jobs are what we're doing. so are the jobs that we're using HPC for. For gender imputation, we're using a statistical software R, which has a gender package. So the package has a function that predicts the gender of a first name given a year or ranges of years in which the person was born. And you can specify like different methods how to do the gender imputation. For example, the SSA is the Social Security Administration Baby Name Database. And depending on which method you're using, you can impute gender for people in Canada, Germany, Iceland, Norway, Sweden, UK, and the US. So for example, if someone's first name is Madison, and we know that this person was born in 1985, what is the probability that this person is a male? Can someone make a guess? It's about 20%. However, if we're not sure when this person was born, so for the same person for a person whose first name is Madison, but we don't know like in which year this person was born, we think it's sometime between 1900 and 1985. Now the probability of this person being a male increases to 90%. And for each gender imputation, it takes about 0.1 second to do the actual imputation. So with the cohort size we have, if I'm using a standard desktop, for example, the one in my office, it will take about 120 days, and that's not feasible. So that's when we started using HPC. So for gender imputation, if you're imputing gender for 100 people, you can either do it sequentially or do them simultaneously at one time. So with parallel processing, we were able to finish the gender imputation for the whole cohort within 2 weeks. Actually, for each of the job, it was done within a day or two. But because the HPC cluster is very popular here at Stanford, there's oftentimes a queue. So the 2 weeks is actually a combination of the actual processing time and the queuing time. But still, 2 weeks is really a big improvement from the 120 days. So thank you, HPC. So the next step we're doing is the race imputation. We're using a method introduced by Imai and Khanna in 2016. So in their methods, they proposed a way to estimate a person's racial group, conditional on this person's last name and the person's geolocation. So a geolocation is a unit by which the US Census Bureau reports the census results. So the largest being a census tract, and the smallest being a census block. So, so the first equation shows how we're going to estimate this probability, a person being in a certain racial group. Using Bayesian rule, we can expand this we can calculate this probability with the formula, so the part on the right-hand side of the first formula. And so the second formula is actually just to show how we're calculating the quantity, how we're calculating this quantity. So from here, we can see, in order to impute race, there are two quantities that we need to know. The first one is given someone's last name, what is the probability of this person being in a certain racial group? So that's the first red block. And the second quantity is given a person's geolocation, what is the probability that this person being in a certain racial group? So for the first quantity, we get that information from the US Census Bureau. The Census Bureau published a list of 150,000 most popular last names. And for each last name, there's a count. How many people are whites, how many people are Hispanic, Black, and then there's a list of racial groups. So from that, we can estimate the first quantity. And for the second quantity, we can also find the information from the Census Bureau. So for each census unit, they report the number of people in different racial groups in that unit. So to summarize, in order to do the racial imputation, we will combine the information from the last name and the person's geolocation. However, in the voter file, we only have people's street address. So how to convert the street address into a geolocation? That is actually a two-step job. First, we'll convert the street address to the latitude and longitude. And it is something down at the geospatial lab here at Stanford. They can process 1 million addresses in an hour. And then the second step is from the latitude and longitude to the geolocation. You can either use a commercial software. We tested that. That's about 5 million addresses in 3 days. Or it can be done as a Stanford geospatial lab, and that's something that we're still testing. So once we have the geolocation information, we'll combine it with voter's last name and do the actual race imputation. So in our cohort, we're imputing race for 40 million voters, and that's something we'll definitely need HPC's help. So we did a test run before. If we're using census tract, it can be done in about 1 week. So the lessons I learned from working on this project, HPC can accommodate cohort studies with very large sample size, and it can significantly reduce computation time. Parallel programming can significantly increase efficiency, but when you're planning for your job, take into consideration that queuing can also add to processing time. And we'd like to thank Steve from the High Performance Computing Center. Steve has been providing amazing support in our project. Whenever we're in trouble or have a question, send an email to Steve. Within minutes, you get an answer or solution. So thank you, Steve. We also like to thank Stace and Claudia from the Geospatial Lab here at Stanford. They're training us to do how to do geocoding. And to Joyce Foundation to fund this project, and to everyone for your interest and time listening to this presentation. Thank you very much. Questions?
So I have a question. You mentioned you're going to be getting the master files.
Mm-hmm.
So is that going to include things like illegally obtained weapons, identify rather than just legally obtained ammunition?
Yeah, I think that's a really good question. So the ones we got are all the legal information that's legally recorded in the master files. So we cannot estimate what is going on in illegal transactions. So we have a paper looking at how gun purchases are changing after mass shooting. So we find, for example, for people who are in the Black racial groups, the purchase rate is actually not increasing as other racial groups. So one explanation for that is probably there are some illegal transactions. So yeah.
What about things like suicide by cop or other types of crime-related suicide?
Yeah, I think for the first step of the project, we're looking at firearm-related mortality. And for the second project, maybe we're looking at not firearm-related. For example, mortality by cops, or even a cancer risks or cardiovascular disease risks. Yeah. Yeah.
So you have 40 million records, right?
Mm-hmm.
How
Yeah.
many are missing the male or female information?
So that depends on which year the voter file is for. So for the 16 voter files, we have some of them are missing gender like 1/3 of the time. Some of them are missing gender like 2/3 of the time. Yeah.
Of these 40 million, they have firearms?
No, these are the voters who registered during the past 16 years. So we have information about 4.8 million handgun purchases during the past maybe, how many years? 15 years? Yeah. Yeah.
I'm wondering, do you do the area weighted average with a certain counties that you think and how that your distribution might be?
So you mean in estimating the mortality risks?
So your conclusion is average out, right, for California?
Yeah, so I think first we want to answer the question how having a firearm affect people's firearm-related mortality. And then we'll look at within each subpopulation, is that association changing, or if in certain subpopulations, the risk is particularly high. Yeah.
So the question was, how does good area and bad area affect the
Yeah, I think that's a great question. So we'll account for that using the census block or census tract information. So we'll account for that factor in the analysis. Yeah, thank you. Yeah.
How will you correct or adjust for the completeness of the data set to account for black market transactions or transactions that might cross state lines and not go through wouldn't be in the database you have of purchase transactions, for example? How will you guesstimate that and correct for that?
Wow, that's a good question. I don't know. I think we haven't thought about that yet. I think the reason is it's hard to get information for black market transactions, and for the across a state too. I think in California it's so that we can get the transaction level data from the Department of Justice, but that's not true across states in the country. So that is also something very challenging. Yeah. If you have comments, we definitely want to hear. Yes, I think that's something that we can also work on, but we haven't worked on that area yet. Yeah, and good comments. We can think about that in the future development and research. Yeah.
I have a question. Yeah, we all saw a video clip about Chinese, lady just pull a gun in 1 week. Then he just kills one guy, rob her, try to hurt her. Yeah. So my question is, according to your data, what percentage of Chinese, related population they own a gun compared to general population?
So for this one, for this project, we're actually in the stage of constructing the study cohort. So I cannot answer that question for yet, but we did look at how the purchase behavior changes within different racial groups after some highly media covered events like mass shootings. So I think the conclusion we got from that is the increase in purchase behavior are most significant in males and in whites, but that increase is not persistent. Maybe within 6 weeks, you see the increasing effect going away. Maybe just people switching their purchasing behaviors to sooner when there is a mass shooting. But we also observe like females tend to buy guns more after mass shooting than males. But for the Asian racial group, I can't recall like if there is a significant effect. Yeah. Yeah.
Another question I have is, it seems to be the people died of ownership, as ownership of gun, died of suicide is more than those does not have a gun. Maybe it's better to compare with the people died of also other tools, ropes, like on the rope. With gun, of course, die of more of gun, but yeah, die of blow or medicine, other methods.
Yeah, I think the first step we want to answer the question like how the firearm-related mortality rates differ in these groups. But in the second step, we want to look at like other like mortalities not directly related to firearm ownerships. So that might include the things you mentioned. Yeah. Yeah.
In choosing the groupings that you went about, how did you decide which groups merit special attention? For example, why is gender more important to study than income level, education, any other kind of dimensions that you could sort the data?
Yeah, I think for that, we definitely, so the decision we made definitely depends on like what we learned from previous studies. So from previous studies, we noticed that the gender is definitely a key predictors in like a gun, firearm ownership and firearm-related mortality rates. But I think these are the 4 things we definitely want to look at. We'll also look at other predictors. Maybe some of them show like a significant predicting power for the firearm-related mortalities. Okay, thank you very much.